Acne scars are changes in the texture of the skin's surface. Acne scars can be felt when you glide your finger over the skin. You can feel an indentation in the skin. If you look closely, you can see the small indentations in the skin. There are different types of acne scars depending on what they look like. Icepick scars are small and deep. They're called icepick scars because it looks like someone took an ice pick or a toothpick and made a small hole in the skin. Boxcar scars are larger and look like squares. They can look like you can put a small cube inside. Rolling scars are also larger than boxcar scars, but rolling scars have smooth edges instead of vertical edges. These acne scars occur after you have acne and last forever unless you do something about it. In addition to acne scars, some people also have discolorations or dark spots on the skin. These are often also called acne scars, but they are actually discoloration. The term for this is post-inflammatory hyperpigmentation, or PIH. Hyperpigmentation is darkening of the skin color, and it can occur after inflammation, thus the term post-inflammatory hyperpigmentation, PIH. The reason there's a difference between true acne scars and PIH is because the treatment is different. PIH will go away on its own, although it can sometimes take weeks to months. PIH can also be treated with a variety of topical products and treatments. Usually treatments for PIH will not treat acne scars, but there are exceptions.